Hey everyone, welcome to the Canine Culture Podcast, where we talk about everything dog. Q&As with veterinarian professionals, rescue operators, everyday topics. We cover everything dog on this podcast. So make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media on both Instagram and Facebook. Thanks again for listening. Now here's that next episode. Hey everyone, welcome to the Canine Culture Podcast. This is your host, Brittany, and today we are talking about movement, mobility, and lifelong health for dogs. We have a special guest today, Dr. Laurie McCauley. So Laurie, thank you for joining us.
Thank you. I'm really excited to be here and to talk to you about something that's so exciting to me and I'm so passionate about. So thanks for having me.
Yeah, of course. I was excited to hear from you. And then when I started to look into your background, I was like, okay, she knows everything. Let me just pick her brain. Let me share it with the world. So let's talk a little bit about you, an overview of your work and what you're up to.
So I actually am the person who had the first rehab, so canine or like almost like physical therapy, but not exactly, clinic in the world. So I literally did general practice, graduated from vet school in 92. I did general practice for 6 years, and dare I say I got bored. It was like, oh, one more cat that's vomiting, and another dog with diarrhea, and a spay, and a neuter, and a vaccine, and I fell down the stairs at 3 o'clock in the morning putting my dogs out, hurt my back, went to my chiropractor who said, I can't fix you. Sent me to an orthopedic surgeon who said, go to a physical therapist. And I was like, whoa! I'm like, oh my God, you guys fix people and then you strengthen them so it doesn't happen again. We need to do that with dogs. And I studied with the only person in the country who was doing anything like that. And that was actually at a, do you remember Alameda East from Emergency Vets, the TV show?
Yeah.
So I was actually in a couple of those episodes because I went there and I studied and we did some research together. And then I came back. At the time I was in Chicago. I opened up the first rehab clinic, designed the first underwater treadmill, fell in love with what I did. It brought that information into the veterinary world, and I taught the rehab certification course for 17 years. 17 years. And I had interns from almost 20 different countries. I love to learn. I got certified in acupuncture and chiropractic and craniosacral and myofascial, and I still continue to learn. I just love what I do. I'm really passionate, and I want to help people as much as I can. So I want to empower people to help pets all over the world. So that's kind of my story.
Yeah, that's amazing. All of your work has influenced how I take care of my dogs, because even, 10 years ago, I was like, dogs need to go to rehab for different issues, whether it's something going on with their neck or their leg or their low back, whatever it is. I have always been a proponent of dogs doing rehab, and all of my dogs have used an underwater treadmill. Not all of them have loved it. Some of them have, some have not. But it's just amazing to see like what that work can truly do for dogs. It's crazy. We had this one Pomeranian, she passed back in October, and her x-rays when we rescued her at 11 years old were, every vet was like, how's this dog walk? This dog, there's no way she can walk. And we consistently did therapy and different modalities, of course, always did laser, we did acupuncture, and she had a full PT regimen that we did almost every day. She didn't love it. She like ran when it was time for PT, but her seeing her run, I'm like, look, she's getting better at running away from PT. So we were able to avoid surgeries. She had a great life. I mean, it's just, I sing it from the roofs whenever people are like, oh, my dog, has arthritis, has a sprained whatever, has a luxating whatever. And I'm like, go to rehab. So thank you for giving all of us that information.
You're welcome. I love it. It's the ripple effect, right? I am so thrilled because now the people that I had as interns are now board certified like I am. And they're teaching others. right? And they're teaching people and they're working on dogs, and it just warms my heart to know how cool this is and how far it's spread.
Yeah. So, what kind of started you even working with animals to begin with? And then I know you said your accident and you working with the PT kind of changed that for you. But is there anything else that really sparked the direction of your trajectory of your career?
If you're asking about how I got into veterinary medicine, when I was little, I was in a car accident and had surgery, and um, let's just say I didn't have the best experience. And my driving force was, I'm going to be a better doctor than the one that worked on me. And I've always believed um, that if you give 110%, you can never say, what if?
Right.
And I never want to go to my grave saying, what if? What if I had just done this? What if I had just tried a little bit harder? So learn as much as you can, do as much as you can, help as much as you can is kind of like my motto.
Yeah. And then once you went from general practice into more of kind of that rehab, what kept you going down that path? Was it the results you were seeing
Oh my God.
and learning?
I have never been bored since. I started I started the first rehab clinic, designed the first underwater treadmill in 98. All right, I got certified in acupuncture in 98, 99. 2000 was chiropractic. I was board certified in 2014 because that's when it started. I have not had a single, and to be fair, I always am partial to the, if you can't fix it, send it to me, right? Because I always want the cases that nobody else can fix. Back when I had my big clinic in Chicago, we had what we called the Walk of Fame. And we had, I don't know, 20 or 30 pictures of dogs. We had a photographer come in and take these pictures of dogs that were told, your dog will never walk again, you should put him to sleep. That went trotting back to the neurologist or trotting back to the surgeon saying, look what we can do.
Right.
So
I bet you had so many of the dogs with IVDD come in, and gosh, not to say anything bad about anyone, but so often that's like you should just go ahead and euthanize, and it's like, really, like there's options now, like, and they're not 100%, but nevertheless, that could be a whole topic. We won't get into that. Okay, so
I will say, it back when, a long time ago, they used to say if the dogs don't have deep pain in 3 weeks to put them to sleep. And I've heard so many stories. And this is why I actually interrupted you to get this out. I have had dogs that they don't start walking until they're 6 or 7 months out and still get to run and jump and play and have years longer life. And even for the ones that don't get to walk again, I have videos of dogs in carts going through the mud, running with their owners, just having an amazing quality of life. To me, it's never any judgment. It's always, but everyone needs to know their choices.
right.
To me, sometimes it's like saying, oh, you know what? Grandma fell and she broke her hip and she's 70 years old, so let's just put her to sleep.
Right.
Right? We don't do that.
Yeah. Yeah, that's a great point.
And these are our kids, like we were just talking about, right? These are, in my world, right? Because everybody has their own values, and that's okay. Everyone should have their own values. My four-legged animals, whether it be my dogs, my cats, my pigs, two-legged, I guess, chickens, they are my kids.
Yeah.
And I would do anything for them.
Yeah. Same, because my dogs are literally my babies. So something you focus on that I think is so important is educating pet parents and not just vets. And why do you think that's essential?
There's many reasons. So there's so many people. And again, I used to live in the Chicago area. Now I live in North Carolina up in the mountains. And it's absolutely beautiful. And I realize there's a lot of people that don't have a vet 5 minutes away, right? So it may be they can't get to the vet for distance. After COVID, so many veterinarians retired or sold out to corporations.
Yeah.
I've had people say, I'm worried my dog has cancer and my vet can't see him for 3 or 4 weeks, right? So there's lack of maybe availability, right? We're talking, they're building 12 new veterinary schools to try to bring more people into the field. And then, of course, there's cost.
Yeah.
And it's crazy. When I graduated vet school, I had $12,000 worth of debt. The average kid graduating vet school now is over $200,000 in debt to start. And then you added education, right? There's acupuncture and chiropractic. All of those are at least 10 grand a piece.
Yeah.
So it's not like the veterinarians are trying to gouge people, but their costs are so high, right? And the cost of drugs and stuff have skyrocketed. The cost of labs have skyrocketed.
Yeah.
It just makes it so hard for pet parents to, and I never want anyone to have to choose. Do I buy groceries or do I take my dog to the vet?
Yeah.
So I want to help them as much as I can know when do I have to go to the vet, right? The professionals are super important.
Yeah.
When can I do something at home? How do I know that my dog's okay, right? What is an emergency? What's not an emergency? What can I fix? What has to be taken care of? My vet is talking about these medications. What's the pros and the cons? Because they have a 7-minute appointment time or a 15-minute appointment time with me. They can't go through everything.
Right.
Right? So how can I help them help their pets live the best quality life possible?
Yeah. I think that's fantastic because, like you said, the accessibility, whether it be physically or financially, I think it is getting a little more difficult and people are having to make really hard decisions. And it's nice to have a professional to provide that information because you can get on Google all day long. You can get on Facebook, you can get on Reddit, but you have no idea like what's legitimate, who are these people commenting, what's their background. And so I think it's helpful to have professionals like yourself kind of giving that input and giving these resources. I think it's crucial at this point.
Oh, absolutely. Absolutely. And that's where my heart is how can I help people help their dogs?
Yeah. So talking about helping dogs, let's talk about movement and how movement is kind of the foundation of health. We could say the same about humans, but we won't get into that. And so let's just talk about movement because I think sometimes people think like walk my dog and or run with my dog, and it seems very like closed-minded. It seems like a one-track kind of thought. So what does healthy movement really mean for dogs of all ages?
So I am going to go into humans for just a second. So I love that you're doing a podcast, and I love to listen to podcasts myself. I do it. I'm one of those crazy people who literally will listen to research and podcasts in the shower, right?
Yeah.
And one of my favorites is, do you know who Peter Attia is?
I don't think so.
Stanford a cardiologist who
Okay.
brings in all kinds of research experts. And one of the things he talks about is the 4 horsemen of death. So it is for humans, and there's a ton of research. The 4 biggest killers of humans are metabolic disease, so like diabetes and that stuff, cardiovascular disease, high blood pressure, heart attacks, stuff like that, cancer, and neurodegenerative disease. And we see the same things in the dogs. And the number one thing he says again and again and again, the most important thing to increase longevity and health span, how long you're healthy for, is exercise.
Yeah.
And it's not just walk your dog. There's, if we go into the nitty gritty for just a second, there's 2 major types of muscle fibers. There's the type 1, which is your endurance, right? So not super strong, but last a long time. That's your walk your dog. That's your endurance exercise that helps with posture. And then the other is your type 2 muscle fibers, which is your strength. So if you see the marathon runner, they're super, super lean and they can run forever, but they don't have a lot of strength. And then you see the gym rats, right? And I say that lovingly. But when you work out, you build your type 2 muscle fibers, and that's your power, but those muscle fibers fatigue. So you really need to do your endurance, walk, run, swim, and your strength building to build both type 1 and 2 muscle fibers, both for health when you're young and also as you get older. Because just by getting older, just by aging, you lose up to 25% of your type 2 muscle fibers. And then the other half of that is if you lay around and don't exercise, we call that disuse atrophy, you lose your type 1 muscle fibers. Right. So if your dog is getting older and they're laying around, you lose a ton of muscle. And the number 2 user of glucose, so the brain's the number 1, the number 2 user of glucose is the muscle. So the more muscle you have, the more glucose you burn, so you don't gain fat. If you're laying around, you lose your muscle, you build fat. So that's one of the reasons we see as we get older, our metabolism changes and we get rounder and less healthy. And exercise is the key to that. And if I can throw one more thing in there, even the, the Family Physicians of Canada have a statement. So to have a statement is like really a big deal, that unless you have an acute injury, so you just had trauma, any kind of up to moderate exercise not only helps with physical function, but it is the number 1 underutilized pain control for pain from osteoarthritis. So if your dog is like, oh, he has arthritis, I should keep him inside. No! Doing the right exercises to help strengthen everything is the number 1 thing you can do for him. Yeah. And it's not going to have the side effects that drugs will. Not to say that drugs aren't needed sometimes. But you know what? It's free to do exercises with your dog. And it's not going to cause any liver or kidney or any other problems.
Right. I think that's a great point, especially on arthritis, because all the time someone says, well, my dog's older, has arthritis, so I just let him lay around. And it's like, no, because you're just making the problem worse.
Right.
And I hope someone hears this and this changes their stigma around that. Right. So, you kind of touched on it, but overall mobility and how that impacts longevity, behavior, well-being. Can you touch on that a little bit?
So, exercise literally, again, I'm going to nerd out for just a second, literally causes chemicals to be released in the body that decrease inflammation and increase something called brain-derived neurotrophic factor. So literally every time you exercise and your muscles start to move, it releases chemicals in the brain that help with cognition. So just doing exercises with your dog, and especially if like you're walking them or you're doing the exercises with them, and you can laugh, but I have my dog do beg, stand, beg. What that is, right?
Yeah.
Down while I'm doing squats. So we both work on our brains and our bodies together.
I love that.
Yes. So mobility is huge. Do you do exercises with your POMs?
Sometimes. We haven't been as good about it lately. We get caught up in like, well, the youngest one needs this and the oldest one needs this. And it's like, what about the middle? And it's finding kind of that balance of like what each of them need or simplifying the routine, because I personally I'll write out such a long routine that it's not sustainable. And people do it too. People are like, all right, starting tomorrow, I'm going to run 10 miles a day, and it's not sustainable. And so I have fallen into that trap as well with the POMs, but their knees need it. Their hips need it. One of them right now, his only exercise is that underwater treadmill. And he does need to be doing a lot more at home because he has really bad arthritis.
Do you want me to show you 1 or 2 exercises that can help all of your POMs and is safe for anything from a 16-week-old to a 16-year-old dog?
Yeah, for sure.
All right. Hold on. Let me grab Sid. Come here, buddy.
So anyone watching, if you're on YouTube or Spotify, you're going to want to take a look at this video for this demonstration. And we have the cutest model.
Say hi. He's 8. He's like the best dog in the whole world. He's literally one of very few dogs in the world that can get on a round ball and walk without any help and walk it forwards, backwards, sideways, and just twirl on top. He is amazing. He came to me and I said, he came into my life. He wasn't what I was looking for, but I'm so thankful to have him. And I said, dude, you have straight shoulders, you have straight knees, and a long back. Yeah. I am a rehab vet. I am not going to allow you to have a cruciate injury, a shoulder injury, an iliopsoas, or a back injury. And I put together an exercise program for him, and that's what turned into Core and More, the exercise program on Optimum Pet Vitality.
Wow.
That's 24 exercises, and one of them is three-legged stance. So he's going to stand here. Also realize that if your dog is starting, so for your older and your young dog, start him on the ground.
Mm-hmm.
For your middle-sized dog, start them on the bed. This way you're not leaning over. And by having it like him, he's doing it on the top of the couch, which is mushy.
Mm-hmm.
It makes it significantly harder. I know
Yeah.
I should be doing something with you. You're like, oh, Mom. All right, so three-legged stance. I have him square. I'm not letting him lean on me.
Mm-hmm.
Super important. I'm not grabbing. I'm using just 2 fingers. I'm coming to his hock or tarsus. I'm going to lift up. And on this movable surface, he has to maintain his balance.
Mm-hmm.
And then we can do that for as long as he's comfortable. And then I very gently put it down. You never want to drop their feet. That's rude.
Mm-hmm.
And then I would move to the next foot. And then on the front, I would come, again, just 2 fingers. Can I have this? Thank you. And I can just barely hold it, but he has to work on his balance. And if your dog doesn't have super strong trunk, pretty quickly you'll see him start to sway as he's trying to gain his balance. No, you got to stand up, bud. All right, that's one. Another is called rhythmic stabilization. Move you a little bit there. So in this, I'm going to tell him to stay, and then I'm literally going to push him. So I'm going to push, stay. Good boy, stay. Yes. Good boy, stay. Whoa, you're falling. Get up. There you go. Ready? Stay. Good boy. So I'm pushing against him here.
Mm-hmm.
Pushing back against me. Stay. Good boy. So that is literally turning on his trunk muscles, the stabilizers around his hips, around his knees, around his hocks, shoulders, elbows, wrists. It's working on all of the stabilizers, and there's no shear force and there's no compression.
Right.
Totally safe for all dogs. Thank you, buddy.
That's awesome. Even if people just did those 2 things in addition to their daily walks, I feel like that could be very helpful, and I need to start doing those regularly. So let's say someone did just add in those 2 things, just those 2.
Yep.
How often should they do them to truly be effective? Like, does it need to be every day?
So it depends, right?
Okay.
If you have a 16-year-old dog and you start doing those and you take him to the point of fatigue, you want to do it like 2 to 3 times a week.
Okay.
If you have an athlete, you could do it 2 times a day if you wanted to, because it's right, because they have the strength and you're just increasing the challenge.
Okay.
So it does kind of depend upon where they're at health-wise.
Okay, that makes sense. And then whenever you talk to pet parents about exercise or rest, what's like the most common misconception, or if there's multiple that you can think of?
Oh my God, yes, absolutely. Thank you for bringing that up. One is my dog just had surgery, and I'm not going to give him pain meds because I want him to hurt. Otherwise, he's going to move, and that's going to damage something.
Oh.
Being in pain releases cortisol, which is like giving steroids, which actually slows down healing significantly.
Yeah.
So please, please, please give the pain meds.
I haven't heard that one. That one blows my mind a little bit, but yeah. Okay. Wow.
People, yeah, pain meds are super, super important. The other is a misconception, even in the veterinary field. Cage rest. He has to be in a cage, except to go out to go to the bathroom. The only time I would do that is, I can't even say that. Your dog just had cruciate surgery. For me, the first week is they're in a small room with a baby gate, right, where they can't jump on anything. But if you put a dog in a crate, that's like putting a kid in a closet, right? They especially if it's like a lab or an active animal, they are uncomfortable in their own skin. So what do they do when they get out? They bounce. Oh my God, I'm out, right? And you're like, stop, stop, stop. And then you're yelling at them. So now the only time they come out, they're getting yelled at. So it's like negative, negative, negative. If instead you have them in a safe, comfortable place, again, it can be an X-pen, it can be like a bathroom or a room. I will tell people if there's a chair in the room, take the couch or take the cushion from the chair and put it at an angle so they can't jump on it. but let them be able to walk around a little bit.
Yeah.
If you think about it, if you had heart surgery today,
Mm-hmm.
tonight, they would get you up and walking around,
True. That's very
right?
true. Yeah. Yeah.
Movement, motion is lotion. Really, it helps the joints. The other thing is anytime you have an injury, just so there's 4 factors that increase the release of a chemical in your body called myostatin. Myo means muscle, statin means stop. So that stop muscle production, age. So we talked about sarcopenia or the old age change. Injury, if you have kidney failure, oh my God, and I'm drawing a blank on the other one, but inactivity.
Mm-hmm.
Being inactive. You go for a plane ride and it's 5-6 hours. Myostatin increases in your body. It stops your body from making muscle, right? So that's why it's super important, that and a whole bunch of other things, that you move every day, right? And it's the same thing for your dog. So think about, let's go the other way. I'm going to go to work for 10 hours. Fluffy's sitting at home, right? Or Fluffy's in a crate, right? If that significantly decreases their ability to make muscle, and getting up and moving is so very important.
Yeah. Yeah, those are great points, especially the one after surgery. I have seen friends who maybe their dog had a TPLO or a similar surgery, and then they try to keep them in a crate, but they're losing their mind in the crate. And then
Yeah.
they go to the vet, and then they get more trazodone, and then they get trazodone and gabapentin to try to keep the dog just asleep for weeks. And I'm like,
It's so bad.
I don't know.
So bad.
Yeah,
And to be fair, the surgeon is concerned about the surgery site,
right.
right? Some of them don't either know, which is why I teach so much, or think about the rest of the body
True.
and the importance, right? So it's not that they're trying to make a problem. And all right, so I want to segue here for 1 second. And if you don't take care of the rest of the body, you're setting it up for other injuries, leading into CCL disease, cranial cruciate ligament disease. Right? So I can tell you that a friend of mine who is a surgeon and an amazing person looked at the dogs that did rehab and the dogs that didn't do rehab, right? Because it's a choice.
Right.
And when he compared the numbers, the dogs that didn't do rehab, there was a 50% there was a 50% chance that they were going to tear their second cruciate within 2 years. The dogs that did rehab, it was 17%.
Wow.
Right? So think about the pain for the dog, the inactivity and the healing that has to go in, the expense for both the surgery, right? I mean, there's so many reasons, one, to do rehab and to exercise your dog and prevent the problems.
Yeah. Yeah, that makes perfect sense. So, talking about prevention, that's perfect. We don't even want to get to surgery. So, let's talk prevention and let's talk about common injuries. And so, what are the most common injuries that you see? And we can keep it related to maybe like movement, mobility, things like that.
Actually, I would say it's more about structure.
Okay.
So if you look at a dog, if their shoulders are straight, so lay back is the angle of the, oh, come here, you, come here, thank you, come here, up. Right, so if I lift him up just a little bit, can you see, here's his shoulder blade. Let's see, and here's what we call the spine of the scapula, where this finger is. So if the scapula sits like this, like in a lab, that's called a lot of layback, right? So let me do it that way. And it means they can reach really far. If the scapula sits more straight up and down, like this, it means he has straight shoulders. Much more, they can turn on a dime because it's a straight arm, right? And much more likely to get shoulder injuries because there's a lot more torque at that joint.
Yeah.
Right? That's a huge one. Then we're going to come to this end. See his knee, right? If he, actually, let's do this standing. Come here, Sid. Come on up. Thank you. Good job. Ready? Come back. Thank you. Can you see how straight his knee is?
Yeah.
Without exercise, this is a cruciate waiting to happen. Right?
And is that because with it being straight, it can just turn and just literally tear if it turns?
We know that dogs who have straight knees are much more likely to tear it. And there's many things that come into it. So it's straight knees, it's the level. So you heard of a TPLO,
Yeah.
tibial plateau leveling osteotomy. So if you looked at the tibial plateau and it sits like this, and the femur's here, there's no sliding. If the plateau sits like this, then the femur wants to slide back on it, and that helps tear the cruciate. If you have a dog that was spayed or neutered early in life, they're much more likely to have a higher angle plateau and tear their cruciate. So nutrition's part of it. Spaying and neutering is part of it. How they're built is part of it. Exercise, again, right? I put together the exercise program so he would never tear his cruciate. Give you an idea, again, I'm a research nerd, I admit it. There was research done on a competitive javelin thrower, and they looked at the fascia. So, I mean, that may be a whole nother topic, but the fascia on his so this is an athlete.
Yeah.
On his non-throwing arm was 0.5 millimeter thick. On his throwing arm was 3 millimeters thick. So 6 times thicker.
Oh, wow.
So when you exercise, you build the fascia, which builds the strength, hi sweetheart, around the joint. So you're less likely to get injured. So you're less likely to have that shear force or that rotation force that's going to cause damage. And with that strength, you don't have the instability that causes arthritis.
That makes sense.
Yeah.
Like when we did the patella surgery for one of our POMs, we did prehab and rehab in hopes of strengthening everything and getting everything ready so that it wouldn't, because since he didn't have that groove in his knee, everything just moved wherever it wanted. And so it was all about, let's get it strong as we can before, and let's get it even stronger after. So we started our rehab, gosh, within a day or two of surgery, I think. I mean, we were on top of it, and he healed perfectly and now runs around, and he's as happy as can be from that surgery. And it worries me sometimes when he runs, but it's okay because I know it's strong. So what are some warning signs that pet parents might miss that something might be about to tear or an injury's on the way?
So things that I see and I teach people are changes in behavior. So there's big changes, like I came home and my dog wasn't excited and jumped up to come see me, right? But they're usually going to see that. Things more like, do you know what the functional daily functional living scale is? So in my head for dogs, the way I look at it is, can the dog rise, right? Rise independently. Can they step into the car? Can they go upstairs? Can they get on the couch? Can they get on the bed? Right? Because if a dog can get into the car, but he has never jumped on the bed, and you work with him and all of a sudden he's jumping on the bed, they may have nothing to do with the lameness, but his strength and his quality of life is now greatly increased. So if your dog's function of daily living is decreasing, they could jump on the bed, but now they don't. They could jump on the couch, and now they can't. They could jump into the SUV, but now they can't. I have to help them. Those are all signs. Going up the stairs. Normally, a dog's going to go up the stairs, depending upon how long their legs are. 1, 2, 3, 4, right? The tiny dogs will go boom, 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 boom. Right? So they have to. But if your dog used to do this, and now he's doing this, right? The leg that he steps up first is his good leg because he's pushing off. The second leg is the one that hurts. Right? That's a common one. Look in their eyes, right? I have a ton of my clients, some of my patients, that when we get done treating them, the client goes, oh my God, their eyes are brighter. So if you look at your dog and they're not like, hey mom, how you doing? Or hi dad, right? They may be hurting or not feeling great.
Yeah.
Right? And again, it's always easier to fix things when they're little things rather than put a Band-Aid on or get them better if they're broken and it's a big thing.
True. What are some prevention strategies? I mean, obviously, exercising them and doing any kind of like prehab, rehab. Is there anything else that you can think of, like preventative wise?
keep them strong. So, do you do yoga?
I do sometimes, yeah.
Yeah. So you know things like, stretching this way and like doing triangle or reverse triangle, right? So we
Hmm.
can do doggy yoga. So having cookie stretches. Do you do cookie stretches with your palms?
Mm-mm.
And that?
I haven't,
Oh, okay. So literally, you take the cookie and you bring it to their shoulder, and then you follow their body to their hip. So you're literally like doing
We're just making
like
them stretch. Yeah.
this way and this way, and you go behind the foot so they get rotation, and they have their front feet up and they go into full extension, and then you have it come down between their feet and they go into flexion.
Hmm.
That is literally stretching all of the lines of fascia,
Hmm.
right? It's the same as if you were doing yoga or Tai Chi. And that in itself, at least in human research, has been shown to increase longevity, health span, and decrease the chance of injury.
Yeah. And that's something you could do daily because those
Oh,
kind
yeah.
of stretches with the cookie, I
Yeah.
mean, a couple minutes, you could do that every single day.
Yep. Yep. And it increases the human animal bond, right?
Yeah.
You're playing to the dog, you're playing the fun game,
Right.
right? And
Right.
and it doesn't have to be like, oh, my dog's overweight, so I'm going to give him, steak, right? Or whatever. It can be, right? Sid works for his food, right?
Yeah.
And if your dog's overweight and you want to do exercises, I always tell people treats are nice, but
Hmm.
you have to then cut back, especially if they're overweight, how much food you're giving, or measure morning and night how much food they're supposed to get, and then use some of it to give them their meal and
Yeah.
some of it for training.
Yeah.
And
We've
so
done
you
that
got
so many times. Yeah.
Yeah.
Yeah. Yeah. They love it. Whenever we have trained our dogs, or like if we're working on drills, we will usually like redact a little bit of that dinner or whatever it might be. That way that calorie consumption is the same. And I mean, they kind of like it. It's like getting fed, three
Yes.
times a day.
Well,
Yeah.
not only that, but have you ever like been full from a meal and
Hmm.
then someone would say, "Do you want dessert?" And you're like, "No, thanks."
Hmm.
Right? Dogs are the same way. If you're going to work with them just before they eat. When they're
Hmm.
hungry. And then they're like, "Ooh, I want that piece of whatever you've got," rather
Yeah.
than after they eat when they're like, "Nah, no, I'm not going to try really hard."
Right. Yeah, that makes perfect sense. Those are great tips. And let's look ahead for you. So I know you have something coming up. It's called Pause and Purpose, right? And tell us what that is exactly.
So I am trying to help as many pet parents as possible help their dogs. So my team and I have put together something that will be coming out. We're doing a soft launch in March, and then I'm sorry, in February, and then our big launch in March. And people will be able to sign up for it. And we have a whole bunch. I know that I've recorded over 40 videos. Plus, we have our Learn and Goes, which there's like 100 videos. And we're going to have a once a month AMA, Ask Me Anything, which
Hmm.
I'm super excited about because that way people can write in what they're concerned about.
Yeah.
Because I have so much knowledge in my brain because I always tell people I'm a big fish in a little pond. Don't ask me about geography or history or anything like that, but I know a lot about where I'm, like my little targeted area. I want to help people learn whatever they want to know to help their dogs. And we're going to have a community so people can talk to each other and share things like, hey, my dog just had laryngeal paralysis surgery.
Ooh,
What do
that's
I
a
need
good topic to
do?
talk about.
Right? There's so many things like Unassisi loop, decreases inflammation, makes them heal much faster, right? There's so much that I can help people with. So that's coming up. That's something I'm super, super excited about.
So it will be a portal and it will have tools and videos and community. And do you imagine it will be sorted by topic? Like, would I be able to
Yes.
go in and do like paralyzed larynx, like kind of search
Yep.
it that way?
It'll have, we have things like hot and cold therapy, when to use it, things for geriatric dogs, things for
Mm,
sporting dogs. I have a new puppy. Now what do I do? right? So you classify it that way. And then as we add more topics, it'll be significantly searchable. So you can say, my
Okay.
dog just had surgery. Do I ice it? Do I heat it? Do I do range of motion? How do I do that? All of that stuff.
That's amazing. Okay, so we'll be on the lookout for Pause and Purpose. And then you also you were the founder of Optimum Pet Vitality. And well, first off, tell us a little bit about that.
Okay, so I taught the rehab certification course for 14 years. I was one of the major instructors. And I left that and stopped teaching for about a year, and I could not teach, right? It's just in my blood. So I started Optimum Pet Vitality in end of 2019. And at first it was for the professionals. People will say, oh, like, I have clients that say, but my vet told me to crate rest him for 6 weeks. And I say, and that's why I teach, right? So that I can help the professionals so they can help the pet parents. And then I realized there's so many pet parents that are so smart and can help their pets that I wanted to help pet parents as well. So Optimum Pet Vitality has courses for race-approved courses, which are our continuing education courses. So it's the highest level you can be on laser, exercises, fascia, cranial cruciate ligament disease, tuning fork. Oh, that's a whole nother subject. And then we have pet parent courses that mirror them. So basically we have our professional courses and then a simplified version for our pet parents that can help them. Like we just talked about Core and More, right? The exercise one that, I even have some of my clients in it with their patients so people can see, right? I love to teach. And I'm very blessed to be able to take complicated things and put it into simple terms and make it understandable and see big picture. So rather than just a course that says, this is how you do it, it is literally, this is how the dog is going to try to outthink you and how to fix that. This is when you watch your biomechanics, because if you hurt yourself, you can't help your dog.
Right.
Right? This is how you do it for the dog, and this is the mistakes you're going to make and how to correct them. All of that is in there for 24 exercises, which is literally all you need to keep your dog healthy, because it fixes everything. I shouldn't say it fixes. It works from the neck to the legs to the trunk to everything.
Yeah. So for our listeners, Dr. Laurie has offered her ebook on the top 5 exercises for geriatric dogs. And so the show notes, I'm going to link it. I'm going to put it on our social media as well. I'm excited to see those. I haven't looked yet. But I'm excited to see those and see what's in there. And then I don't know, maybe I'll film Titan doing them and I'll put it on social media. He's tired of being a model, but he's okay. He can do it. So that'll be in the show notes. So, okay, we're kind of wrapping up here, but what's one movement habit that every pet parent should or could start today?
Every dog that I know, because I'm going to talk about dogs, knows how to sit and lay down. So if you do nothing else, but before your dog gets their bowl of food, if you have them sit, lay down, sit, come, if nothing else, that's a start.
It's simple.
And that will at least bend and extend their joints.
Yeah, that's so simple. So where can people find you? Website, social media? Tell us where to find everything.
So if you search Optimum Pet Vitality, you'll get we have Facebook, we have Instagram, we have LinkedIn, we have YouTube. OptimumPetVitality.com is our website where we have our courses, tons of information. Come join us, join the fun. And like I said, the ebook is like 26 pages. It's 5 exercises that you can start with. And we have some newsletters. There's all kinds of things we can do to help people. And I hope people will be interested in Paws and Purpose, because there's already a ton of great information in there, and we're continuing to make more.
Yeah. This was great, Dr. Laurie. I appreciate you and all of the work that you're doing. Like I said, your work influences my day to day, and I didn't even know. So I love that. And just thank you so much for sharing this. I'm excited to share this with the listeners. And like I said, I'll drop some links in the show notes so that people can find you. So thank you so
Perfect.
much.
Thank you. I really appreciate you having me. You do such a great job, and I appreciate you taking care of the Pomeranians as well as you do. So thank you.
Thank you.
Thank you for tuning in to the Canine Culture Podcast. Please make sure you subscribe to the Canine Culture Podcast on your favorite podcast platform, and make sure you're following us on social media. If you have any recommendations, any topics that you'd like to hear, if you know of any guests that would be good for the show, or if you yourself want to be a guest, please reach out to us. Send us an email at canineculturepodcast@gmail.com, or send us a direct message on social media. Thank you for listening, and please share this with any of your dog-loving friends.